Hello everybody, my name's Jonathan Weir. I'm from Northern Ireland. I had my accident last July mountain biking in Switzerland. So I'm basically over here trying to regain some function. Before my accident I was very active. I done mountain biking during the summer and horse riding in the winter, so I like to be out and about and keep moving, so I'm trying to do the same now. But basically I was away on a holiday with a few friends mountain biking, and it was about a week into the holiday and it was just an accident really. I fell off, and next thing I knew I couldn't move and had to go to the hospital. Basically I'd seen a few videos on Facebook of what sort of things that he was doing after the treatment. So I contacted him to see basically about the treatment and was it available and was it something that he would recommend based on his experience. So he said all good things about it, although his level of injury wouldn't be the same as mine, but with a bit of hope I would still get some motor function and stuff like that. He told me that it's a good treatment, but it's not like you just get an operation and tomorrow you're walking. You need to put a lot of effort and a lot of time into it. It's not just like you do the surgery and then next minute you're good to go, like, which I'm starting to find out now. To be honest, I wasn't that nervous because I seen a lot of other patients had been before me. So if I was the first person, I would be nervous, but I thought it was going to go okay, and it has. Because there was so many patients before me that has already had the surgery. So if I was the first person, then I would be nervous, but there's been other people before, so it should be okay. On the first mapping session, we got some hip flexor and knee flexor movement, which was amazing just after one session. So then we continued that for the next week. After that, then we basically tried to get some different movements, more to straighten the legs, which has been more challenging, but I'm seeing improvements each day, day by day. So as long as I keep seeing improvements and not going the other way, I'm quite happy. We started on the treadmill to get some stepping. It's quite amazing to think that I was back on a treadmill whenever I never thought I would be able to stand or do anything like that again, but it's quite hard work. But if you don't do the hard work, it doesn't pay off. Standing on the parallel bars is a lot better than using the hoist because you know that you're weight bearing yourself rather than having the hoist to hold you. At the minute I'm not able to do that on my own. I'm getting assistance from Beer, the physio, but it's definitely, you feel a lot freer and a lot, like you're doing a lot more yourself. With PT, it's a lot more core balance, trying to activate my core muscles. It's also quite tiring as well, but I've noticed along with the stimulator, it's helped my balance a lot, so it has. And yeah, so with doing so many hours of PT and so many hours of mopping, I have no trouble sleeping at night. Basically because a lot of people had contributed to fundraising. They knew that I was planning on going. At the start I was very unsure whether to go or not to go, but eventually I decided it was the right thing to do. So when I was here, a lot of people had been asking how I was getting on, how the surgery went okay. So basically, so since then the progress has been steady, and anytime I've seen anything that I thought was worth videoing, I videoed it and updated it, and everybody was, very amazed to see how I was getting on. Even myself, I think I'm doing quite well. But I don't think the videos will stop. I think the progress will keep going. To be honest, I didn't know what to expect. Of course, everybody's main goal is to get walking and be back to normal. I basically, at the beginning, that was my main goal, but since then I've had the operation and I understand how difficult. It's not just as simple as you get an operation and tomorrow you're walking. So I know I have a lot of hard work to put in, but I'm getting new goals each day. Big or small, they're still moving forward. So step by step, hopefully, I'll get to where I want to go.